Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Nathan back in here with us this afternoon for his second follow-up adjustment. He got his very first adjustment here at Advanced Chiropractic Relief this morning. We did a video on it, which we put up there. Chiropractors treat the vertebral subluxation complex and neuromusculoskeletal conditions. Now, we did that for a very specific reason, so please go and watch that video. That was his very first treatment. Now, Nathan has been suffering over the past 18 years with severe low back pain and sciatica going down into his legs and into his feet. But he fell, 14, 17 feet
Yes,
out of an attic and fell and landed on your butt, and you crushed two vertebrae in the lower thoracic and upper lumbar spine, T12 and L1, had burst and compression fractures. You had screws and rods from T12 all the way down to L5 for what, a year?
A year.
After, when it first happened, the neurosurgeons put those in there to fixate you so the fractures would heal without paralyzing you, because they said you could be paralyzed right away, right?
Very lucky that I wasn't paralyzed.
Very lucky that you weren't paralyzed. Would you mind sharing with our YouTube
Sure.
subscribers what you just told me about how your experience was for the very first time here at Advanced Chiropractic Relief?
It was better than what I had imagined. I'd watched these videos for the last 4 to 6 months, and I said, I need to go see that man. Again, the massage wasn't helping anymore. So I came out here, and I've never cracked and felt like
It's your first chiropractic
ever,
right?
Yes.
This
I was always
morning.
told to stay away from them, but I'm glad I'm here. I'm thankful to be here.
Yeah, take that, TMA. You know, just because your orthopedic surgeon or neurosurgeon or medical doctor tells you don't go to a chiropractor, they'll hurt you or paralyze you, doesn't mean that's what's going to happen to you. I mean, Nathan had one of the most severe spinal conditions that we have seen in a long, long time. He brought in his diagnostics and all his medical records, which I poured through this morning when I was doing his history and examination. And I mean, he had literally screws and rods all the way down his spine from T12 all the way down to L5, fusing his entire thoracolumbar spine region. And here he is at Advanced Chiropractic Relief for his second adjustment. Are you feeling better this afternoon than you were when you walked in?
I already feel better.
Yep,
Much
great.
better.
Super, let's show him how we did that.
I've never felt that kind of cracking before, but I feel better.
Yeah, we get lots of crack here. That's how you flex your head forward and backwards. That's why the crack addicts love us. And then neutral. We kind of redefined the word crack addict. It doesn't mean you're a drug addict anymore. It means you love the sounds of the cracking of the spine. I'm a crack addict. You can be a crack addict too. You know, and Nathan made a comment when he came in today that I just love, and that's exactly what I said when I first started getting chiropractic care, is I feel great, so can you. He didn't say the so can you part because he already knows I feel great, but he said I feel great after 17, 18 years of severe lower back pain and just getting massages to temper it, right?
It's just a temporary relief.
Yeah. Okay, let's come over here. Which massage is a good soft tissue therapeutic procedure that can be done to relax the muscles of the paraspinal soft tissues and surrounding soft tissues. Slide up a little bit more for me, Nathan. A little bit more. There you go. But I evaluated all his diagnostics that he brought in this morning, and it is safe for me to adjust his entire spine, including the manual spinal decompression ring dinger, which I did on him this morning, and we broke loose a lot of adhesions and fibrotic scar tissue formation in and around where he had the surgery down there in the lumbar spine, thoracolumbar spine. Breathe with your left ear. There you go. Home run. Felt that one all the way down, didn't you?
Sure did.
Yes, sir. No, you're good. Just lay there for a sec. See, he's still kicking. Good. And no, I've never had anybody come out here not kicking. There you go. You notice how I get you sweating every adjustment? You know, that's your autonomic nervous system functioning. So, chiropractic treating the vertebral subluxation complex is in fact treating neuromusculoskeletal conditions you can't get around, here, let's sit down, treating the neurology of the vertebral subluxation complex just because the TMA doesn't want us to. The nervous system is an integral part of the chiropractic methodology and procedure. Now that got a little shorter. Does that tighten up a little bit right there?
A little bit.
Yeah. And you came all the way down here from Nashville to get this done, didn't you?
Yes, sir.
There. Yes, sir. Boy. You still cracking. Even, and let's see if they stay that way. Yes, they do. That should have felt easier that time, Nathan.
It did.
Good. Perfect. Okay, let's turn you on your back now. Now, over the past 18 years, let's slide up this way, since Nathan had his surgery, his spine has been adapting to the biomechanical configuration that it was in after the pins were taken out, and his muscles and ligaments had modeled to that. So what we're doing with him right now is scientifically called spinal remodeling, and that's where we're changing the biomechanical configuration of the vertebrae in his spine, pelvic bones, as well as his extremities, because I adjust everything. There you go, full body adjustment. By the way, going back to last week's agenda on teaching y'all scientific aspects about chiropractic care, chiropractic in the Greek is done by hand. And as you can see, I am adjusting him with my own two hands, as I do everyone that walks in here. I use an instrument at the end to adjust the atlas so we can effect a neuroproprioceptive bombardment into the cerebellum from the atlas being adjusted with the atlas specific adjusting instrument. But that's the only instrument that I use to adjust the spine. There we go. Good. Cracking everywhere.
You're intense.
That's why people come here, because I'm intense.
Yeah.
This one guy came in here today, new patient, and said, I came here because you're more aggressive than the joint. Let's have you flex your head forward and backwards. We like the joint. We get a lot of their patients. And back to neutral. Yep, take a look, man. You right down the gut. Hold these guys up and back. And we're going to come all the way back this way. Yep. Now see, when you come this far back, you should feel that arcing all the way down into the lumbar spine. Good, okay. Try that very same thing again now, Nathan. Woo, it's on swivel. Is that hurting anywhere?
It's a little tight, but it feels better.
Yeah, sore is going to be normal for you over the next 72 hours.
I think so.
Just keep using that crushed ice on there like we talked about, and drinking a gallon of water every day. Is there anything you'd like to share with our YouTube audience around the world?
No, I'm waiting to see in the next couple of days how it goes.
Yeah, we'll be following Nathan up all week this week, so stay tuned for Hardcore Chiropractic from Advanced Chiropractic Relief. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see y'all soon.